Hi, I'm Dr Sanjeev Jain, Joint Replacement Surgeon at Dr L H Hiranandani Hospital. I wish all of you a great and happy 2022. Yes, we are there for helping you, and you are aware of the fact that you all are having a bad time with the COVID. But don't worry, this COVID is going to go away. What you have to do, just keep yourself safe and happy. Maintain the distance, hand hygiene, and of course, naturally wearing a mask can give you an excellent protection from the COVID. But when you think about your body, yes, as an orthopedic surgeon or as a joint replacement surgeon, I can say that you have a joints of your body which need to take care of. You have an age which is aging, and I have a group of people who are senior citizens, 60 plus. They have a problem with the back, problem of the knees, problem of the hip, and they cannot walk because of these painful joints. So need not worry about it. We have a solution for you. We have a very happy solution for you, and which definitely takes off your pain. You can be completely mobile, you can walk around, you can do all kind of activities in your life what you want to do at your age of 60, 70 or 80s or even the 90s. Now when you come to the problem solution, we have a knee patients with an arthritis or hip patient with hip arthritis. We do an advanced stage of surgery which is called a knee replacement surgery or a hip replacement surgery using a high technology, using a computer assisted surgery, using a best available material of joints, and give you an excellent results. To take care of this, we have an excellent team of physiotherapists, excellent team of anesthetists who gives you pain-free, definitely post-op recovery. We have a team of nurses, we have a team of dietitian, and we have a whole team of doctors here to take care of you in a pathway which we call as a clinical care pathway, where when you get admitted to the hospital, you've been taken care of each and every step. Mind you, you don't have to worry about the pain factor, whether it's one knee replacement or both the knee replacement, one hip replacement or both the hip replacement. Definitely, you are going to be completely pain-free. You walk on a very second day or the same day of the surgery. For one joint replacement, you have to stay only one day after the surgery. For both that joints replacement, which has been done same day, you have to be in the hospital for 2 days. What else you can want? We take care of you at your home when you go from the hospital to at home. We have home care services. We are definitely connected with you. Even the smallest problem at the home is taken care by our home care team. So we have a whole gamut of the problem solution here with you, and I think you can be an excellent patient with us, but we can take care of you to an extent that your recovery is remarkable, and you definitely forget that you have undergone a surgery in this hospital. So we have raised the standard, we have raised the bar to an international level. You can compare our results from any of the best to best center in the world, and definitely you'll find that we are definitely at least 1% beyond or above that, the care what we give you. Please believe that we also treat some younger patients. Now we have a patients who are younger age group, they also have a back problem or neck problem, or they are sportsmen, they are gymnastic, they are going to the gyms. So they also have some other sort of problem in their body or the joints. We take care of them really definitely in our hospital, in our orthopedic department, and also in the physiotherapy department. But what I want to say in the end, that please take care of yourself in a COVID. COVID is definitely going to go away, but your body, your joints, your joint pains will remain with you. And if you want a very happy, good quality of life, I'm sure you need to definitely have a phone call away from finding us, and we will definitely help you. Thank you.